Why would I ever be a part of a scam? I would never.
In terms of being scammed, I think people were commenting like in how much 10X Health System charges for all this is like an insane amount of money. Now, he's in a position where he can afford that. Now, just because you're rich and very reputable and you have a successful career doesn't mean you're not susceptible to getting scammed. Now, could he have done the same thing without? In this video, we're going to be reacting to Dana White commenting on his progress with Gary Brecka from 10X Health Systems. It seems like Dana has gone through a health transformation. He's looking much better. He says he's feeling much better, but they go more into specifics of what he actually did. I want to comment on that, and we'll talk about the good, the bad, and what may be open for interpretation. So let's get into it.
This is Gary Brecka. Many of you have heard me talking about him over the last several months. I'm telling you how incredible this guy is, how he changed my life, how different I feel. And I read a lot of stuff online that, listen, I get it. People are going to be skeptical, and people were talking about that I'm getting scammed. You think I would get scammed? You think I would allow myself to be scammed? No. I've lost like 36 pounds. You see people on Instagram all the time that lose weight. People decide to lose weight, they lose weight. But there were a lot of different problems with me that were going on that I've been talking to doctors for 10 years. None of them could fix any of my problems. And many of you out there have the same things. Sleep apnea. You can't sleep. You're snoring, you're choking, whatever it is in the middle of the night. What do? They give you a CPAP machine, which doesn't work, or you leave it on for a while and rip it off. I had problems with my legs, and I had problems.
Okay, CPAP machine is actually can be a very important treatment for people with sleep apnea, because if you are going through the night and not getting enough oxygen, that is going to cause severe problems down the line. And so CPAP machines can be annoying. You do get used to it after a while. Obviously, the better option is to try and figure out how do we get rid of the sleep apnea, which for a lot of people, one of the biggest ways to reduce sleep apnea is to lose significant weight. So whether Gary Brecka or 10X Health Systems or whoever is involved in your health journey, if you lose weight, you're going to be able to get off the CPAP machine. I imagine that the doctors he was working with in the past are giving the CPAP machine because he needed it. Maybe they should have focused more on losing weight. I'm not sure. We know what they did, but it's not. Let's say, for example, he didn't lose the weight, then he probably should still be on that CPAP machine.
Problems with my truck. I had problems I didn't realize I had that doctors didn't even tell me. In 5 months, this guy completely changed my life. And this is for all the naysayers that are saying it's not true and it's all bullshit. Well, right here, everybody was saying, well, share your blood work with us. We just did my blood work yesterday, and here you go. He's going to give you the results of my last blood work test, which now has been, I'm in like 20 weeks, or 25, whatever, 5 months I'm in this.
Yep. For 5 months, we got the before and after blood work. You can't fake these numbers. It's not my opinion. This is just a fact pattern. So for those of you that are familiar with blood work, I'm going to put this up online so you can actually see it. Dana's given us the authority to do that. So you're going to see in the CBC, when you start looking at blood work, you're going to see a measure called hematocrit. This is the measure of his blood viscosity, meaning how close was his blood to motor oil or how close is it to water.
So that's a good way to explain it for the layman, but it's not actually just a measure of viscosity of your blood. But if you have really high hemoglobin or hematocrit, your blood in general will be more viscous. Also, CBC, for anyone that's wondering, it stands for complete blood count. We order these all the time as routine labs in the hospital. When we have patients, everyone generally gets a CBC in the morning unless there's a reason you wouldn't need it. We try not to waste lab tests in general, but most times if there's anything you need to get monitored, your white count, your hemoglobin, because hemoglobin will show you whether or not a patient is anemic. It could also point to whether or not they're potentially bleeding if you see a rapid drop in hemoglobin. So these are things we order fairly routinely, and you should get like once a year as a routine health checkup.
You're going to see that the hematocrit has come down, meaning his blood has actually gotten thinner. This is just done through therapeutic phlebotomy, like going and actually giving a regular standard blood donation. You're also going to see one of the amazing things.
So I don't know if he puts everyone on therapeutic phlebotomy. Just because you have a higher hematocrit, if you're within the normal range, there really wouldn't be an indication for continuous therapeutic phlebotomy. And sometimes if you're using like steroids or TRT or things like that, and you're over in terms of the dosage required, you could increase the viscosity of your blood. You see higher hemoglobin, hematocrit levels, and then there could be an indication for that. But I hope it's individualized, let's say, to Dana White, and that he actually needed it, because I don't necessarily know he did. And I would hope that's not just like, well, part of the 10X health system is everybody gets therapeutic phlebotomy. Not saying it is, I'm just pointing it out.
Is the white blood cell profile start to improve? There's all these funny names for white blood cells: eosinophils, basophils, neutrophils, lymphocytes. But what you're going to see is these things line up in a perfect V-shaped pattern. This means that his immune system has actually strengthened. We've taken the same number of immune cells and we've oriented them properly, and now his immune system's like an iron horse. You're going to see it in his CBC. And then you'll look at the next section called Comp Metabolic Panel.
I don't know about this V-shaped pattern for your... So the basophils, eosinophils, right? These are different types of white blood cells that serve different functions in the body. For example, if you have a parasitic infection, a lot of times you're going to see elevated eosinophils. Now, there's standard ranges that are normal for each of these different types of white blood cells, and those standard ranges don't generally make... I'm not really sure what he means by a V-shaped pattern. As long as you're within normal for all of those, your immune system... From the I hate the term, like people throw this out so much, your immune system, your immune function. But if your cells are within normal, that means there's nothing that it's indicating is relatively wrong. I don't think you need to like try to adjust the proportion of white blood cell count unless there's a very specific indication for that.
This is where we start looking at organ function. You're going to see that his kidneys have not only increased their filtration rate, but the poison.
We call that a CMP in the hospital, a comprehensive metabolic panel. So in the morning when I'm thinking about ordering labs for patients, for example, I'll either order them a BMP or a CMP, a basic metabolic panel or a comprehensive. The difference really is that in comprehensive metabolic panels, we also look at LFT. So you'll see ALT and AST markers. So if, for example, I have a patient that's taking a medicine that could be hepatotoxic, and I want to monitor on a day-to-day basis what their liver enzymes are doing, because if they go up, that might be an indication that that medication is causing an issue, then we'd order a CMP. But a lot of times, there's no need to constantly monitor your liver enzymes, and so we'll just order BMPs for patients.
Levels are coming down. Kidneys filter something called blood urea nitrogen and creatinine out of the bloodstream. When that comes down, you've got less poison in the blood. So then we get to some of the really fun things, like triglyceride. A lot of you might know that a triglyceride...
That not necessarily true either. Those alone are not poisons. A poison is usually a substance that even in small quantities, if you ingest, if you absorb through the skin, or somehow your body uptakes, that could cause illness, injury, or death, and it's usually in small quantities. A BUN and creatinine is a good marker for your kidney function. And so, for example, when we define stages of CKD, or if there's an acute kidney injury, we look at, is the creatinine bumped up from baseline levels? And a BUN, blood urea nitrogen, is also just another marker in the blood that helps us determine what potentially types of kidney injuries that you have. But you should not just randomly try to reduce BUN and creatinine levels.
So then we get to some of the really fun things, like triglyceride. A lot of you might know that a triglyceride is just a fancy name for a fat. So your level of triglyceride is the level of fat in your blood.
So I guess you could call triglycerides a surrogate of fat. It's a type of fat. In biochemistry, we say triglycerides are an ester, which is formed from glycerol, and then 3 fatty acid groups.
It should be 150. When we pulled Dana's blood in June, it was 764. We got a life-threatening alert call at 1 o'clock in the morning from LabCorp because that number was so high. When I met Dana, I told him I was surprised it wasn't painful to tie his own shoes, because when I saw that, I knew he was having something called claudication.
And it was painful to tie my own shoes.
Okay, just it's a lot of, I don't know if it's embellishments, the right words, but a lot of taking just lab markers here and then relating it to definite symptoms. So for example, just because you have high triglycerides does not mean you're going to have claudication. Now, claudication is something when you have peripheral vascular disease. Essentially, you're not getting enough oxygen to your, let's say, extremities, so you could have claudication in your legs, things like that. Is it possible that you do have claudication and you have high triglycerides and you have peripheral vascular disease? Yes, but just because you have, let's say, a 700 or above triglyceride level does not mean that you are going to be experiencing those symptoms.
My old shoes. That's where he got me. He told me things about me that I didn't even tell anybody. So he knew just from looking at my blood. And he's telling you, They were at 764. I was on the verge of a stroke or a heart attack or something bad. In 5 months, he got those down to what?
140.
Yeah, so I mean, to have a triglyceride level of that high of 743 is not good. We definitely would want to get that down. If you're above 1,000, that's like an indication to go on triglyceride lowering medication specifically. So statins are not specifically triglyceride lowering medications. So that would be something like a fibrate. And so usually, I mean, he was close to the range where he would need to be on a medicine targeted specifically towards triglycerides. Now, with that said, lifestyle modifications is always a great place to start, and losing weight can definitely lower these levels. So it looks like that's what happened here, which is great. So let's see.
143 from 764 to 143. Total cholesterol from 243 to 173. Here's the amazing thing. If you know anything about cholesterol, there's a really, really nasty one called VLDL. Very low density lipoprotein, or very lethal cholesterol. This is like chewing gum floating around the bloodstream. It's really sticky.
So VLDL cholesterol at a high level, again, is not good. It can eventually lead to significant cardiac events. And so to get that down is definitely helpful within range. So as you can see here, the reference range that LabCorp has is 5 to 40. And it seems like he was able to do that through whatever he was doing on this plan, which is a good thing.
You cannot make this up. Almost 80% lower than the day that we pulled it. So now he's actually not taking cholesterol medication anymore. He was doing these Repatha shots.
Oh yeah, by the way, I've been on blood pressure medicine.
So Repatha is evolocumab, which is a monoclonal antibody medicine. It's actually a really great medicine, and I'll try to explain what it is. So the mechanism of action is that it is a PCSK9 inhibitor. So PCSK9 is a protein that promotes the degradation of LDL receptors on the liver. So that means if you have a lot of this floating around, let's say, then you're going to have less LDL receptors on the liver. Now, you would want more LDL receptors on the liver because then it would pull in the LDL particles from the blood and break them down. So what this drug does is it inhibits PCSK9, which means you have more LDL receptors, and therefore you are pulling in more LDL particles and have a lower LDL in the blood overall. So that's a simplified version of the mechanism of action of how this works. It can definitely be a very beneficial drug. Could he get off it from weight loss alone? A lot of things you can get off from weight loss alone. So I'm not sure all the things that Dana White did again in the 10X Health Systems, but what's pretty crazy is that how significant just weight loss can really do in turning your health around. It can get you off statins and PCSK9 inhibitors and potentially lots of other medicines. If you're pre-diabetic, it can get you out of the pre-diabetic range. Things like this, which you would think can't just be done with weight loss alone, actually can be. So the best thing you could do, no matter who you're working with, is try to lose weight, get it into a healthy weight, exercise, have good nutrition, and that's going to be the best possible thing you could do for your overall health.
Pressure medicine, thyroid medicine, and cholesterol medicine for over 10 years, probably more like 15 years. Now, in 5 months, I'm literally on none of that medication. I'm not taking any medication now. This is all just supplements.
Yeah, your blood pressure was 116 over 85 the last time the nurse took it. Testosterone stayed right in the
That's a good blood pressure.
We're doing TRT, hormone replacement therapy. Not a huge deal there.
Well, he says not a huge deal. I mean, that testosterone level is good. I would imagine, though, that being on TRT, I'm not sure if he just started it with 10X Health Systems or if he was on it already, but that in itself can help you burn more fat. Having a more constant testosterone level, depending on how often he's injecting the testosterone, or there are also creams and things like that, you have a higher basal rate of the testosterone, because even for like someone like me, my testosterone is going to go through peaks and troughs during a day, and also depending on what I'm doing, right? So if I'm crash dieting, my testosterone is going to go down. If I'm not sleeping as well, testosterone is going to go down. This is also why if you test your testosterone in the morning or versus at night, you're going to get different results. So some people that try to just get TRT will actually test it at night, which I don't recommend you do. You should figure out what your actual testosterone is, do it in the morning, do it it after you've gotten good sleep and you've been eating sufficient amount of calories, so you can actually get a good baseline of what your testosterone is. So if you're, let's say, every 2 or 3 days giving yourself testosterone, you're going to have a much more constant basal rate, which can actually be helpful in terms of burning fat, losing weight, putting on muscle if you're working out. And I'm not saying this is a bad thing at all. I'm just saying that that's not something I would just brush past, is the fact that he's on TRT, especially if he started the TRT when he started to lose this weight. I'd be interesting to know. I mean, he might have been on it for a while. I'm not sure.
Other couple things that are amazing. He'd never had his level of homocysteine checked. Homocysteine is one of the most inflammatory compounds in the human body. It's an amino acid. When it rises, it causes a lot of havoc in the body. It can make your throat swell in the back. It can actually start your blood vessels can clamp down because it irritates the lining of the blood vessel. You got 63,000 miles of blood vessel in your body. When they get narrow, your pressure can go up. His homocysteine actually fell from in the mid-20s, 22, all the way down to 11.7. That means we cut that inflammatory marker in half. How can you tell? Well, you can measure it in the blood, but you can also see it in his organ systems. His liver function has improved. All the inflammations come out of the liver, AST, ALT enzyme. The measure of liver poison, called alkaline phosphatase, has plummeted. So low kidney.
Alkaline phosphatase is not liver poison. Again, it's just a marker in your body. Additionally, his liver enzymes might have gone down. This is just speculation because he stopped the statins can actually cause your liver enzymes to go up a little bit. They could be technically hepatotoxic, but doesn't mean that you're in any danger just if they're slightly elevated, if he was still within the normal range. On top of that, I don't really think there's any guidelines or indications for checking your homocysteine levels. Not saying you can't do it, but I think out of everything so far, this one seems to be the most far-fetched in terms of something that they're focusing in on reducing. All right, let's move on.
Poison, low liver poison, lower cholesterol, lower triglycerides, lower sticky cholesterol. And now we get to the big one.
And this inflammation that he's talking about, those of you that out there that have sleep apnea or snoring, that's part of, have you ever got, if they don't put you on a CPAP machine, I had a doctor in LA told me what we need to do is go in there and cut your tonsils out and then widen your throat. What? That's what they told me to do. And now it's all gone because it was inflammation inside my throat. You might have the same thing.
Yeah, so imagine.
So that seems like aggressive treatment off the bat for CPAP. Again, I would be willing to bet that the biggest impact on Dana White's sleep apnea was his weight loss, not decreasing inflammation, whatever that means, but losing weight. There's actually some studies that show that a 10 to 15% decrease in weight can cause a 50% decrease in the symptoms and severity of the obstructive sleep apnea. And actually losing fat in the neck, the tongue, the oropharynx, all these areas will decrease the obstruction and therefore improve the overall amount of oxygen that you're getting, your sleep apnea symptoms. And so again, the biggest thing you could do is lose weight.
Yeah, so imagine you bring this inflammation down and now you're breathing better, possibly even not requiring a CPAP machine because you don't want to be suffocating at night.
That's true.
Was when we got the blood sugar. You see, when you take these different debits, you have high blood pressure, you have diabetes or pre-diabetes, you have high triglycerides, high cholesterol, you have hypertension, you have hyperinsulin, high levels of insulin, and you put them all into the same body. This is what was very dangerous to him. Dana was standing on the edge of a very, very steep cliff. So there's a measure of blood sugar in our bodies, not your glucose, which measures your sugar at the time the blood lab is done, but there's something called hemoglobin A1C. For those of you that know what this is a 3-month average of the blood sugar. This tells you what your average blood sugar has been for the last 3 months. You can't game this number. If you ate a box of donuts before getting your blood work done, it wouldn't move this number.
That's relatively true. Hemoglobin A1C is what we use to diagnose diabetes, prediabetes, etc.
He was not only pre-diabetic, he was 0.4 of a point away from becoming diabetic. And at 0.4 of a point away from becoming diabetic, he's now at 5.3, which is perfectly normal blood sugar.
Yeah, that's good. And that makes sense.
Doctors doing my blood, every few months. They didn't even tell me that. They didn't tell me about my triglycerides, and I definitely didn't know about that.
I mean, if that's true, that's bad on the doctor's part. That shouldn't be like any good primary care physician, most doctors in general, like you got lab work done if there's abnormalities like that, high triglycerides. If you're pre-diabetic, they should have a conversation with you. I don't know if he wasn't in that range when he got those labs done. And if he was, the doctors absolutely should have told him. I just, I'm happy he's doing well, honestly. I like Dana White a lot. And clearly there were some benefits to the system he's doing. But I don't think it's not good to demonize all physicians as if we don't tell people their blood work and go over their labs with them and things like that, because that is what good primary care physicians do. And so I feel bad. He definitely sounds like he had bad experiences. I can't really comment on it, but yeah, this is definitely something like if you're pre-diabetic, like you should have a conversation. And one of the things that should come up in that conversation with doctors is work on diet, lifestyle, losing weight, etc., not just pushing medications. However, if you do need medications and there's a good indication for it and you have a informed discussion with the patient and you agree that, you know, I when I speak with patients, I try to make it like a team. I lay out the options, you make recommendations, and you do what they are comfortable with and what will work for them. But you also want to make sure they know all their options and that you're putting their interests above anything else.
And the other thing is, not only are sugars really high, hemoglobin A1C, but something else was really high called insulin. So when your sugars rise, your insulin rises. As you become more insulin resistant, it takes more insulin to lower blood sugar. The thing about insulin that escapes most people is that the primary role of insulin is not to lower blood sugar. The primary role of insulin is to block other forms of energy use in the body. So his insulin was at 32.4.
I don't know about that. I mean, insulin definitely has many roles in the body. One of the major things, though, is regulating your blood sugar. So when you eat and you have a high sugar meal, your body's gonna secrete insulin to control your sugars, which is why, like, isolated blood glucoses, let's say your sugar are high for a specific moment in time, unless you do have insulin resistance or things like this and you're diabetic, your body is usually, like my body, if I went and had lots of cupcakes, I'll probably secrete more insulin and it'll regulate my blood sugar well. And just because in a certain snapshot in time on labs the insulin was high doesn't necessarily mean that he's insulin resistant just from that data point alone.
12 points higher than the normal end of the range. It's now 3.4. He has 1/10 as much insulin in his bloodstream as he had.
Yeah, like again, this is just a snapshot in time. So he, like, it's going to change completely throughout the day. If he just had a meal, if he was fasting, etc. Like, I guarantee you his insulin is not 3.4 throughout the entire day.
When we started. And he's eating healthy, regular meals.
That's good.
Majority of his caloric intake from healthy fat. It's hard to wrap your arms around the concept that you have really high fat in the blood and you need to eat a high clean fat diet in order to bring that down, but that's exactly what happened to him.
When you get into the whole nutrition debate, I mean, in general, just losing weight, you know, making sure you're getting your macro and micronutrients in, but as long as you're in a appropriate caloric deficit, you're losing weight, a lot of these markers in general will go down regardless of what diet you're on. And that's why lots of diets you'll hear like, oh, the keto diet will cure your diabetes, or this vegan diet will cure your diabetes, or whatever it is. Any diet where you're losing weight appropriately, you're going to see overall improvements in health. Even if it's, for example, a high-fat diet. If you have good fats and you're in a caloric deficit and you're losing weight, then that's great.
Called insulin resistance. Your body can't burn fat. When you can't...
That's not true. If you have insulin resistance and you're in a caloric deficit, your body will burn fat.
Can't burn fat, where's the first place it builds up? It builds up in the blood, which is why his triglycerides were so high. Insulin rises, triglycerides rise. People that have the highest blood fat eat the most sugar. Sugar makes you fat, not fat. That is a fact.
So
maybe that would be more correlational than causational, because again, even if you eat a lot of sugar, let's say, again, I keep saying the same thing, but if you are in a caloric deficit, even with high amounts of sugar, you're going to lose weight. Now, it's much harder to be in a caloric deficit if you're eating high caloric, dense, high sugar meals, because those are usually higher in calories, but it's not just sugar equals fat.
So
Fat, not fat.
there are a bunch of people online saying, oh, this is this is that. Why would I lie? What do I care? You know what I mean? And why would I ever be a part of a scam? I would never.
Okay. One, I don't think he's trying to lie at all. And I think, honestly, by just losing the weight alone, and I'm not sure if, to be honest, he's on like a GLP-1 agonist that's going around a lot lately. It's been very effective in regards to weight loss. That plus the TRT was probably a good combination. He might not be on a GLP-1 agonist. He might have just been really regimented with his diet too. Either way, it doesn't matter. The results you're getting from losing the weight is going to be the biggest player in this whole equation. But I don't think he's trying to lie by any means. I think he's doing what he thinks is best for him. In terms of being scammed, I think people were commenting like in how much 10X Health System charges charges for all this is like an insane amount of money. Now, he's in a position where he can afford that. Now, could he have done the same thing without this? Maybe. Like if he just lost the weight, he probably could have. But if it worked for him, I don't think that is a problem. I think though there are a lot of like, even I mean I keep pausing this video like every 30 seconds because there's something that's like slightly factually incorrect. And so I think that's what people are talking about when they say that he gets scammed. Also, just because you're rich and very reputable and you have a successful career, which Dana White does, and I love the UFC, I really like Dana White, doesn't mean you're not susceptible to getting scammed. I actually see celebrities all the time being scammed by different quote unquote health professionals that are not actual MDs or DOs. And it doesn't mean you can't know what you're talking about if you're not an MD or DO. I don't really subscribe to that either. I think that people can be very evidence-based as physical therapists, as nutritionists, dietitians, whatever you are, even nothing, without any degree. You can understand the literature, no proper guidelines. But what happens is, what I've seen is like people, when you have more money, you want to always be like on the cutting edge of things. And that is a great opportunity for different snake oil salesmen to take advantage of people with that money, because a standard doctor in general may not be offering anything that seems like something the average person can't get their hands on. Now, there, of course, even like, for example, like GLP-1 agonists, let's say he's using that. Not everyone can get their hands on that because it could be expensive unless it's covered by insurance, which you need to meet certain BMI requirements, etc. But I think that's what people are talking about when they say get scammed. Now, it seems like this worked for him. Again, I think the biggest contributor is going to be the weight loss, the fact that he's on TRT. But whatever needed to be done for him to get his health in order, I'm happy with. I just don't want the general public watching this to feel like they need to be doing all of these things, getting all of these labs done, because it is good to get labs done. Don't get me wrong. It's just be careful in drawing certain conclusions just from lab markers alone.
I would never. Those of you that don't want to do this, don't do it. Nobody's asking you to do this. Nobody's trying to make you do this. Do whatever you want. Stick with your doctor and good luck to you. But
see, that's my only problem. Like, I don't think most doctors are trying to harm their patients, which is like the undertone. I think it's like an us versus them category. A lot of people like to lump doctors into like pharma shills. Like, I promise you, most doctors are not getting paid by big pharma. And there are a lot of great doctors. I know certain doctors that are on the cutting edge doing certain things. They just want to make sure they're done with evidence-based guidelines. I mean, that's in my future what I plan to be doing. Like, again, I don't think giving GLP-1 agonists is bad. Giving TRT is necessarily bad when indicated for certain people. Doing frequent blood work is not bad unless you are just testing for all these random things. I think, there are some downfalls to going looking for everything, because then you might be focused on a marker that was irrelevant but is outside the normal range by LabCorp standards, and then you're going down a rabbit hole. But I don't think everyone should stop seeing their doctors. That's the point I'm making.
This is the reason I've been doing this, because I know where I was, and I thought this is part of being 50. I'm 50, I'm over 50 now, and here we go. That's not true. This is the realest guy that I've ever met in the medical field. This is a guy who came to me and said, you do what I tell you to do, and I promise you I'll make all this stuff go away. Sounds like bullshit, right? Far from it. So
yeah, that you should never say that as a physician. I'm pretty sure Gary Brecka is not a physician. I think he has like certain physicians in his staff. Again, that doesn't mean someone doesn't know what they're talking about. I don't like the appeal to authority argument. So just because you're an MD or DO doesn't mean you know what you're talking about either, to be quite honest. I know people that don't have degrees that know evidence-based guidelines better than people with degrees. So I don't subscribe to that argument either. But saying like, if you do what I say, I'm going to make all of this go away, that is a very aggressive statement to make to a patient, and not something I would ever promise. You should be careful with your language when you're talking with patients. So you say, look, this is what the data shows. These are the protocols we're going to put you on for these reasons. And hopefully this is the types of reductions that we're looking at. Everybody's different. It could take some time. Regardless, moving in the right direction is going to improve your overall health. But that sounds like a bold claim to make.
I did all this, and I'm laying all this out there for you because I know there are some people out there that desperately need this type of help. And I'm telling you right now, and I told you before, Gary Brecka is the guy. 10X Health Systems will change your life.
All right. So in summary, I mean, regardless, you could tell that Dana White is in better health. I think a few of the things that he did in the 10X protocol clearly was beneficial. His labs do look better. So I don't really have a problem with any of that. My problem is just the bold claims, the demonizing of doctors in a way, because there's a lot of people in this like biohacking world, I would say, that kind of just go off the rails in terms of what they promise, what they say. and not a lot of it is evidence-based, and there's not always caution. I wouldn't go as far to say that Dana White was scammed. I mean, clearly his health is in better shape. If it worked for him, I'm happy for that. I encourage everyone watching this video, if you're trying to improve your health, to speak with your physician. You could even speak with an obesity specialist if you're trying to lose weight and you've struggled for a while. There are a lot of FDA-approved medications now that are really, really helpful for weight loss. And so this has made a significant impact on patient outcomes. And then also just working on diet, lifestyle modifications, making small changes consistent over time will really add up and hopefully improve your overall health. So wishing everyone the best. Would love to hear your thoughts on this commentary in the comments below. If you have any questions, let me know, and I'll see you in the next one.